That's a very good question. Actually, a very good question, because you know, people come in and they say they've got a toothache, and you know, you do everything in terms of diagnostics, and you literally you come up almost empty-handed. I feel dissatisfied when I can't give a definitive answer to somebody why their tooth is aching. One of the obscure reasons of a toothache could be a middle-aged person that's actually suffering from a blockage of their arteries of their heart. You could actually have a toothache in your upper left or upper right that usually is a referred pain, for which it would be called basically your starvation of blood to your heart. It's a sign that you're potentially have some cardiovascular disease and maybe on the road to a heart attack. That's rare. The first thing that comes to mind is when you have a sore tooth and you don't know why it's sore. I'll give you two examples. Lady presents with 3 implants, and she's got a toothache in her implant. Well, how can you have a toothache in an implant? Well, she was grinding. She was actually grinding and creating such forces on that complex of implants that it was translating into the gum, the bone, and sinus, and she literally actually started swelling up. And the swelling was not actually a cavity or a gum disease. It was actually a traumatic swelling, just like a bruise. So we gave her a specially designed night guard, and symptoms disappeared. That's an example of, let's call it tooth pain, but even not tooth. But another one is, you know, you could actually get bumped. You could jump off a ladder and click your teeth together, or get a line drive from a baseball and it hits your jaw and your teeth click together, and you can crack a tooth. So a tooth could be absolutely pristine. You look at it, you take an x-ray. If you don't look at it under the loops, or if you know, you get some magnification, or if you've got very good vision to start with, you might be able to see that crack or fissure line in the tooth. And with diagnostic, you know, pressures in selective areas, you could find out that the tooth is actually sensitive from a fracture.